Hi everyone, it's Dr. Custer. Today we're going to do a lecture on an introduction to statistics for medicine. So let's get started. My usual disclaimers. I'm not a statistician. I understand a little bit about statistics and I'm relaying that info to you. This video is for educational use only and is not intended to be sold. I love collaboration, so please contact me at the email listed if you have any projects you'd like to collaborate on, and I don't have any disclosures. So the goals of the lecture, this is what we're going to go through. Statistics and the scientific method, types of variables, measures of central tendency, measures of dispersion, validity and reliability, and finally bias. So just a general overview of some stuff you need to know for statistics. So what is biostatistics? I'm not trying to bore you guys with this, but basically, statistics is collecting numbers, data, and then just interpreting and analyzing it, so evaluating that, and drawing conclusions. So biostatistics is basically just that process, but collecting and examining data related to living things, hence biobiology, my favorite subject. And then biostatisticians, what do? They analyze data and statistics on living things collected during medical research studies so we can draw conclusions or make predications. So this is what it is. Why are statistics important? As a resident and as a person practicing medicine pretty much for the rest of your career, you'll be reading through a lot of literature, online in journals, different sources. And having a basic understanding of statistics and biostatistics will ensure that you're able to critically appraise what you've read, which is super important. This is necessary to evaluate the evidence presented so you can apply best practices. Make sure, that you are all awesome doctors and are practicing great evidence-based medicine. So let's start real quick with the scientific method. Most of you, I'm sure, have remembered this from high school science. So the scientific method, you're going to ask a question, do some background research to flesh the question out, construct a hypothesis based on your background research and what you've developed, and then from that you're going to test with an experiment, analyze the results, draw conclusions, and if your hypothesis is true, or if your hypothesis is false or partially true, you basically are going to do either way. You're going to be communicating the results, either to a peer-reviewed journal for review and publication of results, or to go back to the drawing board and examine your experiment and see what kind of factors could potentially have, influenced your results. Things like personal bias, small sample size is a huge one, maybe not so sound experiment design. So you're going to redesign and start over. So that's the scientific method. So let's talk about variables. Variables are just defined as anything that has a quantity or quality that varies. The independent variable is the one being manipulated by you, the researcher, and the dependent variable is what is impacted by that. Confounding variable, which we'll talk about in detail, may affect the dependent variable. And then this idea of the control group, which is the group not manipulated by the researchers, and this data is used as a benchmark to measure how the other tested subjects do. So here's a quick example. This is a really easy one. Suppose a study is designed to explore the effectiveness of different weight loss techniques on obesity. So in this study, the independent variable would be the type of diet assigned, so that would be the one that the researchers manipulate. The dependent variable would be the weight of the subject, so what results based on the independent variable. The control group, you would have no diet or any type of weight loss technique, and you just measure the weight of those people and compare those to the experiment group. And then one type of confounding variable that could be considered is the subject's clothes, for example, that can cause variation. So you would want to control for that by weighing each subject naked. So that's just an easy overview. Now we always talk about this 4 types of variables. This was developed in 1966 by Stevens. And we'll just real briefly go through these. Nominal variables are categorical, and the values can't be ranked. So examples of nominal are things like gender. We have male, female, other, etc. Hair color, brown, blonde, red, black. Just things that are qualitative that you can't rank. There's no value assigned to them. Ordinal, however, are qualitative variables, but their values can be ranked. So there's some sort of ranking order. In this example, it's aggression. It can be weak, moderate, strong, intensity. Likert scales, where you have strongly disagree to strongly agree, would be another example of ordinal. Also things like education levels. Interval variables are variables that can be ranked, and the difference of the values show the difference between the values. So one example is temperature in Celsius. You can see there the difference between 20 degrees and 40 degrees is 20 degrees. But it does not have a true 0 point, and this is a distinction. Another example of an interval would be time. And then we have ratio, and ratio are just interval with a true 0 point. And so these would be things like height and weight. So it's important to have a working knowledge of these 4 types of variables. All right, let's get started on measures of central tendency. So the mean, everyone knows this from high school, I know, but the mean is the average value, which is basically the sum of all your values divided by the total sample number. Median is the observed value that equally divides the left and right half, so directly in the center of the data set. Mode is the most frequent value of the data set. And then we have the outlier, of course. Outliers are extreme and unusual values observed in a data set. They can be caused by recording or measurement error, or sometimes by natural phenomenon. And they typically affect the mean more than the median, and the mode is unaffected. So that's important to remember. All right. So here you see an example of how an outlier can affect your data. So on the left, we see the data set without the outlier, and the mean, median, and mode are all right around 5. And the standard deviation is 1.04. Now, in the right, we've added an outlier of 300. So with that outlier, you can see the mean has changed drastically. It's increased. The median hasn't changed much, and the mode is unaffected. But look at your standard deviation. There's much wider variability there. So just briefly, statistical distribution, the center curve here is normal distribution, where you see the mean, median, and mode all at the 50th percentile. This represents a perfectly symmetrical distribution. Now, if you had a outlier in the positive direction, you could have a positively skewed data set, and this just means that you'll see your mean goes up into the positive direction, but again, your mode is unaffected. And the same way that the negative, if you have a negative outlier or the data is skewed to the left, you will have your mean here, mode's unaffected. So here's a quick problem on measures of central tendency. An ICU patient has a cannula placed after cardiac surgery to monitor SBP. 24 values are recorded over a period of 6 hours, with a maximum value of 141 and a minimum value of 96. If the next recording is 200, which of the following is most likely to remain unchanged? So here we have a range of 96 to 141. So clearly, if the next one is 200, that would be an outlier. So we talked about outliers. They do affect what? They affect the mean, but what is most likely to remain unchanged, and out of these choices you see, is the mode. And that's what we just talked about. Here's another quick question. Patient with severe heart failure is placed in the ICU. Over the next hour, the pulmonary artery wedge pressure readings are 26, 20, 20, 27, 14, and 27. And then it says, which of the following is the median? So all you have to do is look at the values in order, and you'll see right here in the center is your median. So the average of between these two numbers would be 23, and that's your answer. So now let's go on to measures of dispersion. This includes range, standard deviation, and standard area of the mean, and percentile. These are all measures of dispersion or variability. So the range is just the difference between the highest and lowest value in a data set. And percentile is the percentage of population below a specific value. So interquartile range is the difference between the values corresponding to the 75th and 25th percentile. So let's talk about standard deviation. Standard deviation and variance, they just relate to the average amount of dispersion or variability about the mean. Here is the formula for standard deviation. I don't expect anyone to memorize this. Just note that it's basically the sum of the difference of the means over the sampled number minus 1. And so we'll go on and look at this. So this is a normal distribution. And here we see the mean right at the 50th percentile. There's a couple things about standard deviation to note. One of the first things is there is this concept of z-score. So here under here, you see from -3 to 3, the z-score is simply how far away the data point is from the mean. So a z-score of 1 means 1 standard deviation. My mouse is acting crazy, sorry. A z-score of 2 means 2 standard deviations, and so on and so forth. And then you see the 68, 95, 99 rule, which is important to understand, you guys. So all that means is 68% of your sample, if it's normally distributed, will lie within 1 standard deviation of the mean, 95% within 2 standard deviations, and 99% within 3. And that's just important to know when you're evaluating data. And then just one last thing I want to point out is, and this is important for confidence interval stuff, the 95th percentile is 1.96 standard deviations, and the 99th percentile is 2.58. And we'll go through that more in the next lecture. So the effect of standard deviation. Here in the center, the blue, we see a mean of 0 right in the middle and a standard deviation of 1. So that's what that curve looks like. Now, if we increase the standard deviation, we widen it. So you can see the green curve here. That range here is twice as large as the blue curve. So that's what happens as the standard deviation increases, your curve widens. On the right side, you see the red curve where the standard deviation decreases, and this shows it's a narrower range. So that's the effect of standard deviation on your curve. All right, let's move on to a clinical example question. A large study of cholesterol levels reveals that the parameters normally distributed, the mean's 230 and the standard deviation is 10. So then, according to the study, 95% of the cholesterol observations lie between which of the following limits? And you remember from the 68, 95, 99 rule that 95% of the data will lie within 2 standard deviations, remember. So if the mean is 230 and the standard deviation is 10, 2 standard deviations will be 20, obviously. So our range will be 230 minus 20 and to 230 plus 20. So that's 210 over 250, and that's the answer. All right, basically the same number. 230 is the mean with a standard deviation of 10, a study of 400 patients. So based on the results, how many patients do you expect to have a serum cholesterol over 250? Now that would be greater than 2 standard deviations. So 95% of the data lies within 2 standard deviations, but how much is greater than that? That would be the remainder, 5%. Now we divide it by 2 to represent either side of the tail, either tail of the curve. And so what is 2.5% of 400? The answer is 10. All right, validity and reliability. Validity is pretty easy. It's the credibility or believability of research results. So there's internal and external validity. Internal means that the instrument or procedures used were actually measuring what they were supposed to. And people refer to this as the research was done well, meaning the changes in the dependent variable were actually caused by the independent variable and avoids confounding factors. Now, external validity is the ability to generalize the study results to other groups and settings beyond those in the current experiment. So these are the two concepts of validity. Internal, what you were trying to measure was actually measured, and external, what you found was able to be generalized beyond your specific sample. Now, reliability is the repeatability or consistency of research results. So if your data are valid, they must be reliable. However, data can be reliable and not valid. So let's go through a real quick example. Let's say a researcher devises a new test that measures IQ more quickly than the standard. If the new test delivers scores for a candidate of 87, 65, 143, and 102, obviously that's not reliable or valid, and it is fatally flawed. However, if the test consistently delivers a score of 100, but the candidate's real IQ is 120, the test is reliable. Its repeatability is of the same results is great, but not valid because it's not measuring the actual what it's supposed to. However, if the researcher's test delivers a consistent score of 118, that's pretty close, so the test could be considered both valid and reliable. So that's just an example. All right, last topic today is bias. First type we're going to go through is selection bias, which results when subjects selected for the study are not representative of the study population. And there's a couple examples that we're going to go through. Measurement bias, which results from inaccurate estimation of the exposure and/or outcome. And we'll specifically look at these two. And then we'll go through quickly confounding, which results when the effect of the main exposure is mixed with the effect of extraneous factors like we talked about earlier. All right, so let's start with selection bias. Selection bias results from selection of study subjects who do not represent the general population, like I just said. One example, sampling hospitalized patients as a control. It can lead to exposure frequency not necessarily representative of the general population. And this is called Bergson fallacy, and I don't expect anyone to remember that term. Referral bias occurs when the likelihood of unusual outcomes increases as a result of referrals to a study. So, for example, subjects that are referred to studies at specialized clinics, they're more likely to suffer from an outcome different from the general population. All right, the next kind of bias is selective loss to follow-up. This can occur in cohort studies when more members of one group is lost to follow-up than the other. Non-response bias may occur when the study design allows subjects to decide if they participate, so you may have more non-responders in one group. Prevalence bias occurs when the incidence is estimated based off prevalence and data becomes skewed by selected survival. So one example of this would be asking survivals of an MI about their diabetes status. The diabetes status may be underrepresented in that population because the patients that had MIs with severe diabetes died more often. All right, and then the last selection bias, we have susceptibility bias, which occurs when treatment regimen depends on the severity of the condition. And one example is patients are assigned to either PTCA versus medical management depending on their health status. And obviously the sicker patients have to have medical management, so that changes the groups. All right, let's talk about measurement bias. This results from inaccurate estimation of exposure and/or outcome. So there's two types we're going to go through. Recall bias can occur in case control studies when there's overestimation of the effect of the exposure. And we'll go through an example. Observer bias, which is also known as ascertainment, detection, or assessment bias, occurs when the investigator's decision is adversely affected by knowledge of the exposure status. So one example of observer bias, let's say that there's a study where patients have renal biopsies taken and a group of pathologists examine the samples and diagnose whether or not there's hypertensive nephropathy. So let's say there's two groups of pathologists. One group is blinded to the race of the subject that the biopsy came from, and the other group is not blinded. So let's say that the group that wasn't blinded reported hypertensive nephropathy more in African American subjects than the other group. This could be due to observer bias, and that's all they mean by that. Let's go over confounding. All right. Confounding refers to the bias that results when the exposure-disease relationship of interest is mixed with the effect of extraneous factors known as confounders. So in order to be considered a confounder, that factor must have a link with both the exposure and the outcome. And let's say, here's an example. Let's say a study finds a strong association of alcohol use and lung cancer, but doesn't take tobacco use status into consideration. So if the data were stratified to a smoker-non-smoker, they might see that there is no association between alcohol use and lung cancer once you account for the smoking status. So smoking is a confounder, and the observed effect of association was attributable to confounding. All right, so how do we limit confounding? In the design stage, randomization, matching, choosing controls with similar confounding variables that match the cases. Restriction, you can limit your study inclusion criteria, but then again, that limits your external validity. And in the analysis stage, of course, you can do stratified analysis like we just talked about if the confounder is identified. And there's more complicated statistical methods as well. So let's do a quick bias question. A study is conducted to assess the relationship between use of an over-the-counter pain reliever in pregnant women and development of neural tube defects in offspring. Mothers whose children have neural tube defects and age-matched controls with unaffected children are interviewed using a questionnaire. The study shows that the use of this pain reliever increases the risk of neural tube defect even after adjusting for race, other medications, family history, and serum folate level. Which of these biases is of most concern when interpreting the study results? So this is something you may see often in studies with pregnancy and adverse outcomes. And we just talked about this. This would be a potential case of recall bias. So that's it for the lecture today. I prefer text or email right there. Please contact me with any questions. And now that you're done with this video, you can go back to New Innovations and copy and paste the link to the post-lesson quiz. Hi everyone, it's Dr. Custer. Today we're going to do a lecture on an